Today we're going to be talking about fertility and the factors that cause fertility problems. So before we go ahead with the discussion, let me give you a little brief about myself. I'm a practicing IVF specialist. I have done my post graduation from the prestigious SAIT GS Medical College and KEM Hospital. Subsequent to that, I followed my passion for infertility, and I have been exclusive infertility and IVF specialist since then. Um, that's about me. I practice at Cloud9 Hospital, Malad, and I also practice at my own place, which is INI IVF Hospital at Borivali West. This was a little bit brief about myself, and now let's directly go into the topic. So, infertility as a word is something that I don't really prefer using. I prefer calling myself a fertility specialist versus an infertility specialist because I think the word infertility has a really negative, stigma to it. It's got a negative angle to it, which I don't really like. So we're going to try and restrict the discussion to fertility and fertility related problems. I'm going to try and restrict from using the words infertility. Okay, so if we can quickly just go ahead with what infertility is as a definition, it is a couple who fails to conceive after 12 months of unprotected intercourse. This couple would be termed as infertile or having to have some fertility problems or subfertile, as I like to call them. There is some sort of fertility issue that they face. Once we've understood this definition, we have to understand that this is a fairly common problem, है ना? ये समस्या is just getting worse and worse, बहुत ही बढ़ती जा रही है, and it's as common as 15 to 20% of population. मतलब कि हर 6 में से एक कपल इनफर्टाइल है, जो कि fairly common problem माना जाता है. सो अगर हम इसे थोड़ा और स्टेटिस्टिकली समझें तो फर्टिलिटी प्रॉब्लम्स जैसे पहले माना जाता था कि सिर्फ फीमेल रिलेटेड इश्यूज है, ऐसा गलत है. इट्स नॉट ट्रू. 1/3 प्रॉब्लम्स फीमेल रिलेटेड है, 1/3 प्रॉब्लम्स मेल रिलेटेड है, एंड 1/3 प्रॉब्लम्स या मेल रिलेटेड फीमेल रिलेटेड दोनों कंबाइंड या फिर अनएक्सप्लेन्ड है. सो 1/3 फीमेल, 1/3 मेल and 1/3 या combined factors या unexplained factors. So once we've understood the sort of base about infertility, अब हम इसे थोड़ा सा और समझेंगे. So when is the correct time to visit an infertility specialist? ये बहुत ही common issue है जो बहुत सारे patients या friends या couples ऐसे पूछते हैं that at what point should we get worried and कब हमें एक fertility specialist या फिर एक डॉक्टर को कंसल्ट करना चाहिए. So इसके भी कुछ fixed protocols है. What I tell my patients, there's no right and wrong time. When you feel in your head, irregardless of जो की protocol set है, that we've tried and I think we want to visit, it should be fair enough to visit. Sometimes I have so many couples now who are visiting before they start planning as well. They want to understand the process. They want to understand prenatal vitamins, etc. So there is no right and wrong time to visit the doctor. But by and large, अगर आप 35 years से कम उम्र के हैं, as a female partner I'm saying, and आपने एक वर्ष means 12 months unprotected intercourse try करने के बाद भी अगर आप pregnant नहीं रहे हैं, तो फिर this is the correct time to see a fertility specialist. अगर आप 35 years से ज़्यादा उम्र के हैं, then maybe even in 6 months it is important. You cannot wait for the entire year. 6 महीने of trying, not falling pregnant, and you must see the doctor. अभी why this difference is because as the female ages, जैसे ही age बढ़ती है female की, time बहुत ही important factor play करता है, क्योंकि egg quality बहुत ही majorly compromised होती है with age. So it's important that after 35 you don't waste too much time. 6 months of trying, and if you're not pregnant, you must see the doctor. This was basic about infertility. when to see the doctor. And now I'm directly going to jump into the topic for today, which is the factors causing infertility. So before हम ये factors को समझे, हम थोड़ा बहुत female anatomy को समझ लेते हैं. So here I have a small picture which is showing us the female reproductive anatomy. तो सेंटर जो कि सबसे प्राइम रिप्रोडक्टिव स्ट्रक्चर है, इसे हम यूट्रस या गर्भाशय कहते हैं. एज यू कैन सी, गर्भाशय के दोनों बाजू पे देर आर फिलोपियन ट्यूब्स, और ये फिलोपियन ट्यूब्स गर्भाशय को ओवरीज या अंडकोश से कनेक्ट करते हैं. सो इफ आई वाज टू अंडरस्टैंड, एंड दिस इज द वजाइना बिलो, सो देयर इज अ यूट्रस या गर्भाशय इन द सेंटर, फिलोपियन ट्यूब्स pair है, one on each side है of the uterus, and fallopian tubes connecting the uterus to a pair of ovaries. अब हर महीने प्रोसेस क्या होती है ड्यूरिंग द मेंस्ट्रुअल साइकिल? जैसे ही पीरियड्स आ जाते हैं, एग ग्रोथ स्टार्ट हो जाता है दोनों में से एक ओवरी में. जैसे ये एग बड़ा होते जाता है, मिड साइकिल में अप्रोक्सीमेटली ये ओवरी में से एग रिलीज हो जाता है या ओव्यूलेशन इवेंट होता है. जैसे ही एग बाहर रिलीज हुआ, ये एग फिलोपियन ट्यूब में एंटर हो जाता है. कैन यू सी देयर इज अ हॉलो देयर, और वो फिलोपियन ट्यूब्स में यूट्रस की तरफ ड्रिफ्ट होता है. वो टाइम पे अगर द कपल हैज अनप्रोटेक्टेड इंटरकोर्स, द स्पर्म गेट्स डिपॉजिटेड हियर, तो वो स्पर्म स्विम करके सर्विक्स में से यूट्रस में जाएगा, and from the uterus it's going to enter into the fallopian tubes. जो फ्यूजन है एग और स्पर्म का, वो भी fallopian tubes में होता है, और जो जीव या एम्ब्रियो क्रिएट होता है आफ्टर द फ्यूजन ऑफ द एग एंड स्पर्म, वो भी fallopian tubes में बनता है, and that starts drifting towards the uterus, and approximately 8th day तक implantation हो जाता है. Subsequent to implantation, वो बेबी यूट्रस में ग्रो होता है, एंड विद इन 14 days फ्रॉम ओव्यूलेशन यू कैन एक्चुअली चेक अगर प्रेगनेंसी रुकी है या नहीं. अगर प्रेगनेंसी नहीं रुकी तो हार्मोन की मात्रा ड्रॉप हो जाती है एंड द फीमेल गेट्स अ मेंसेस. सो दिस इज अंडरस्टैंडिंग बेसिक अबाउट हाउ अ फीमेल रिप्रोडक्टिव स्ट्रक्चर वर्क्स. सो इसी के बेसिस पे आई हैव सॉर्ट ऑफ डिवाइडेड द फैक्टर्स व्हिच कॉज इनफर्टिलिटी. So to understand, let's go from lateral to medial. First है ovarian problems, या more commonly called ovulatory problems. अगर egg ही नहीं बन रहा या female gamete ही release नहीं हो रही, pregnancy becomes a problem. Second is tubal. ये tubes है, अगर tube में कोई blockage हो, adhesions हो, there's something which is disturbing egg and sperm का fusion, that is the second category of problems, tubal. थर्ड कैटेगरी इज यूट्रस, बिकॉज जहां इम्प्लांटेशन होने वाला है, अगर उसमें पैथोलॉजी हो तो इम्प्लांटेशन इश्यूज होते हैं. फोर्थ प्रॉब्लम इज स्पर्म प्रॉब्लम्स. अगर स्पर्म काउंट, मोटिलिटी, मॉर्फोलॉजी प्रॉपर नहीं है तो देयर इज एन इश्यू विद प्रेगनेंसी. एंड सबसे लास्ट और सबसे अहम मैं कहना चाहूंगी इज अनएक्सप्लेन्ड फैक्टर्स, जो कि इनमें से जो हमने कैटेगरी की, देयर इज नथिंग इन दैट, एंड देयर इज स्टिल infertility or subfertility or fertility problems. So now let's discuss each of these in a little more detail. So the first problem is ovulatory. अब ये first भी है, सबसे ज्यादा common भी है, और very frequently easily overcomable भी है. So when I just mentioned in the beginning that 12 months तक a couple which has tried to conceive and has not fallen pregnant, फिर वो सब फर्टाइल है और फिर उन्हें डॉक्टर के पास जाना चाहिए. बट आई वुड लाइक टू एड वन फैक्टर देयर, दैट द कपल शुड बी श्योर दैट द फीमेल पार्टनर इज हैविंग मेंसेस ऑन टाइम. 12 महीने तक विद इरेगुलर पीरियड्स ट्राई करना सॉर्ट ऑफ यूजलेस है, क्योंकि अगर एग ही नहीं बन रहा टाइम पे और एग ही ओव्यूलेट नहीं हो पा रहा, तो 12 मंथ्स हैव बीन अ वेस्ट, क्योंकि प्रेगनेंसी नहीं रुकने वाली. So it is important that when you are trying for those 12 months, that your periods are regular. So now coming to ovulatory problems, as simple or as common as eating habits being irregular, overweight problems, lifestyle factors, not adequately exercising, things as simple as this, stress, can sometimes disrupt a standard ovulation cycle. मतलब ovulation इन महीनों में adequately नहीं हो पाता. More pathological problems like thyroid disorders, जो कि बहुत ही common है in the reproductive age women. Having PCOS, which is a significantly common, again, I would call it a lifestyle problem, can cause ovulation disruption. So all these factors के वजह से prolactin excess, sometimes some medications, etc. अगर egg नहीं बन रहा in the ovary, pregnancy becomes a problem and periods would then become irregular. Now, in the ovarian factors of infertility, एक बहुत ही दूसरा ओवेरियन डिसऑर्डर से नॉट रिलेटेड फैक्टर जिसे मैं डिस्कस करना चाहूंगी वो है एज. ओके, सो एज जो है वो सिग्निफिकेंटली फीमेल गेमीट क्वालिटी को अफेक्ट करता है. सो पीक fertility of a woman is between her 20s and 30s. As she ages beyond 30, this fertility potential tends to sort of decline. And ये क्यों हो रहा है? क्योंकि जो एग्स है ओवरी में उसकी क्वालिटी घटते जा रही है. काउंट तो घटते ही जा रहा है विद एज एंड क्वालिटी भी घटते जा रही है. सो एज हैज अ वेरी इंपॉर्टेंट एंगल टू प्ले, जो कि ये सब फैक्टर्स में मैंने नहीं डिस्कस किया इन दी ओवेरियन क्वालिटी एंड ओवेरियन काउंट. एंड यहाँ पे एक बहुत इंपॉर्टेंट पॉइंटर AMH, जो कि हर किसी के दिमाग में है. अगर आप फर्टिलिटी रिलेटेड कुछ भी ट्राई किया है अब तक, एनी सॉर्ट ऑफ फर्टिलिटी प्रॉब्लम्स, AMH बहुत ज्यादा अहमियत दिया जाएगा आपको ड्यूरिंग योर फर्टिलिटी डिस्कशंस. एंड व्हाई इज दैट? Because AMH has now recently picked up a lot of importance. Delayed marriages, delayed childbearing. Everybody is trying to push the age of the first baby, because of which the egg count घट रही है, which is a natural phenomenon, and इसलिए AMH की importance थोड़ी सी ज्यादा बढ़ गई है. But ये AMH और fertility का कोई direct connection नहीं है. जी हाँ, I'm going to repeat it. AMH has no impact on your natural fertility. AMH सिर्फ आपको बताता है कि आपकी ओवरी में एग काउंट क्या है. अगर एग काउंट कम है तो ऐसा जरूरी नहीं कि आप इनफर्टाइल है या आप सब फर्टाइल है. AMH सिर्फ टाइम टू प्रेगनेंसी गॉज करता है. मतलब कि अगर आपका AMH नॉर्मल या हाई है, यू हैव सम टाइम टू प्लान योर फर्टिलिटी जर्नी. और अगर आपका AMH लो है तो इट इज इंपॉर्टेंट दैट आप प्रेशियस टाइम वेस्ट ना करें. गो अहेड, डू द टेस्ट, स्टार्ट विद अ एडिक्वेटली सक्सेसफुल ट्रीटमेंट. एंड कभी कभार अगर बहुत ही लो है तो यू मे बी एडवाइज्ड अ मोस्ट एडवांस ट्रीटमेंट लाइक IVF टू अचीव द प्रेगनेंसी. नॉट बिकॉज आप नेचुरली कंसीव नहीं हो सकते, ओनली बिकॉज आपका AMH आपके टाइम टू प्रेगनेंसी को थोड़ा क्रूशियल बना रहा है. एंड इफ वी वांट टू अचीव द प्रेगनेंसी फास्ट, we must use the more successful method. So that was about the ovulatory problems. Second factor is tubal. अब ट्यूब्स या पेल्विक प्रॉब्लम्स बहुत है. मोस्ट कॉमनली इन आवर कंट्री है ट्यूबरकुलोसिस. ये अननोटिस्ड या अनडायग्नोज जाता है क्योंकि इसमें और कोई सिम्टम्स नहीं होते. कभी कभार इन द पास्ट देयर मे बी सम लॉस ऑफ वेट और देयर मे बी इवनिंग राइज ऑफ टेम्परेचर, बट ये भी बहुत सारे लोगों को नहीं होता. और कॉक्स कॉन्टैक्ट या TB कॉन्टैक्ट तो एवरीवेयर अराउंड अस है. So it is possible that genital TB या fallopian tubes का TB है जिसके कारण या वो ब्लॉक्ड है या फिर उन ट्यूब्स की फंक्शनैलिटी डैमेज्ड है जिसके कारण प्रेगनेंसी नहीं रुक रही. Pelvic infections because of chlamydia and other bacterial gonorrhea etc. जिसके वजह से pelvis में adhesions बैठ जाते हैं. मतलब कि अराउंड द fallopian tube बहुत सारे फाइब्रस बैंड्स डेवलप हो जाते हैं जिसके कारण ट्यूब और ओवरी की एनाटॉमी स्पॉइल हो जाती है और प्रेगनेंसी रुकने में प्रॉब्लम्स हो सकती है. अपार्ट फ्रॉम दैट, ट्यूबल ब्लॉकेज, एडिशंस इनसाइड द ट्यूब, ट्यूबल फंक्शनैलिटी कॉम्प्रोमाइज, एंडोमेट्रियोसिस, ये भी एक बहुत कॉमन कंडीशन आजकल तो बहुत ही ज्यादा कॉमनली सुना जाता है, जिसके वजह से जो नेचुरल यूट्रस या गर्भाशय की अस्तर है दैट इज फाउंड इन द पेल्विस, जिसके कारण एडिशंस हो जाते हैं और ट्यूब की एनाटॉमी और मोटिलिटी स्पॉइल हो जाती है. तो ये थे सब ट्यूबल फैक्टर्स या पेल्विक फैक्टर्स. Third factor which I said was uterine. This is not so common as a cause of infertility, but बिल्कुल existing problem है. यूट्रस के वॉल में अगर फाइब्रॉइड्स की गांठ हो, या फिर यूट्राइन लाइनिंग के अंदर अगर मस्सा हो, या फिर चर्बी की गांठ जिसे कॉमनली कहा जाता है, या फिर इट इज मेडिकली कॉल्ड एज अ पॉलिप, अगर ये प्रॉब्लम्स हो, या फिर यूट्राइन लाइनिंग के अंदर जैसे एडिशंस बाहर पेल्विस में थे, वैसे कभी कभार यूट्रस के लाइनिंग के अंदर भी हो सकते हैं, जिसके कारण इम्प्लांटेशन इश्यूज हो सकते हैं और प्रेगनेंसी रुकने में प्रॉब्लम्स हो सकती है। अगर यूट्रस बल्की है, मतलब इट इज इंक्रीज्ड इन साइज बिकॉज ऑफ एडिनोमायोसिस, इन वजह से भी प्रेगनेंसी इश्यूज हो सकते हैं। Coming to the fourth factor, which is sperm. Uh, ye, Usually in the sperm, there are 3 points that I would like to note. One is the count, one is the motility, and the third is the morphology. Obviously, बहुत सारे दूसरे factors भी हैं, जैसे volume, uh, DNA fragmentation, etc. There are a lot of other things, but these are the three most important pointers जो कि एक semen analysis report में check किए जाते हैं. Count usually should be above 15 million per ml. Motility roughly between 32 to 40%, depending on what sort of motility you're looking for, fast, moderate, slow. And morphology 4% से ज़्यादा normal forms होने चाहिए. So this was coming to the male factor. Nowadays, smoking, alcohol exposure, pollution, job stress, work stress, etc. इन कारणों से भी sperm count, motility, quality सभी कुछ affect हो रहा है. Obesity affects males as well. So if you are obese, not working out, and there's a sperm problem, it could be related to that. Thyroid problems, diabetes, all of these end up affecting the sperm as well. Lifestyle में I would like to point that अगर आप chronic laptop use करते हैं और उसे directly अपने lap पे रखते हैं, तो heat exposure has a definite relation with a poor sperm count. To make sure heat exposure आप कम करें, laptop को directly पैरों पे ना रखें, tight pants, underpants ना पहने, so things like this, okay, जिससे heat exposure avoid हो सके, will end up helping the motility. So heat ends up affecting motility. So these were basic male related factors. I'm not going into too much detail because उसका एक पूरा separate discussion हो सकता है, which will take a lot of time from here. Last and most important, which I would want to talk about, is the unexplained factor of infertility. Now, if I discuss the unexplained factor, this is the most difficult for a couple to process because uh, it's easier when you know a cause. तो अगर मैंने कहा कि आपका ovulation नहीं हो रहा, या tubes में blockage है, या uterus में problem, it's easier to to understand, okay, this is happening and this is why I'm not falling pregnant. But अगर unexplained factors है, यानी everything on paper is completely normal, but फिर भी pregnancy नहीं रुक रही, this is sort of very difficult to accept and sort of difficult to understand why you require treatment for it. But यहाँ मैं एक important factor कहना चाहूंगी कि unexplained इसलिए है क्योंकि इसे हमने टेस्ट नहीं किया. ऐसे कुछ factors हैं in the body जिसकी टेस्ट अवेलेबल नहीं है. To give you an example, अभी egg quality है, ये जब तक eggs आपके ovary में है, मैंने माइक्रोस्कोप के अंदर तो देखे नहीं. I don't know what is the intrinsic quality of the egg. So that may be a significant factor affecting. Second is the sperm quality. All I am looking for is the sperm count, motility, morphology. I still don't know what is the fertilization potential. वो sperm की quality क्या है? So these things, the gamete quality, intrinsic quality issues affect कर सकते हैं. Sometimes tubal, हमने जो ट्यूब टेस्ट की जिसमें हमें पता चला कि ट्यूब पेटेंट है, बट ये हमें पता नहीं चला सॉरी कि ट्यूब फंक्शनल है या नहीं, मतलब कि ट्यूब के अंदर की लाइनिंग या फिजियोलॉजी एडिक्वेटली वर्क कर रही है या नहीं. सो दिस मे बी अनदर अनएक्सप्लेन्ड फैक्टर. थर्ड है सर्विक्स. सर्विक्स जो कि यूट्रस का दिस पार्ट ऑफ द यूट्रस जिसको ओवरकम करके स्पर्म को जाना पड़ता है इनसाइड द यूट्राइन कैविटी, वहां पे भी कुछ सिक्रीशंस होते हैं जिसके कारण द स्पर्म sometimes are blocked from going up. A lot of sperms don't manage to reach inside the uterine cavity, जिसके कारण भी अनएक्सप्लेन्ड इनफर्टिलिटी हो सकती है. सो ये अनएक्सप्लेन्ड इसलिए है क्योंकि जो स्टैंडर्ड बेसिक टेस्ट हम करते हैं, they are not clearly giving us like a reported problem, but obviously there is something inside which is not working correctly, जिसके कारण pregnancy नहीं रुक रही. So unexplained, though it is difficult to understand, difficult to accept, it is a very, very existing, very, very common also problem that couples face nowadays. So this was बेसिक अबाउट इनफर्टिलिटी एंड जो फैक्टर्स इनफर्टिलिटी कॉज करते हैं. अगर आप इनमें से कोई भी फैक्टर्स से डील कर रहे हो या फिर आप एक कपल हो who have been trying for certain amount of time and have not fallen pregnant, then it's important that you see your fertility specialist. जैसे कि मैंने समझाया, the time that you should see. I would like to re-emphasize that there's no right and wrong time, and whatever time suits you. If you think you've tried adequately and you must see the doctor, then don't worry, go ahead, see the doctor. It's not necessary that in your first visit आपको सभी कोई investigations दिए जाएंगे. Probably just a routine counseling session. There may be things that you are doing wrong, that you are not understood correctly, your fertile window, etc., which just maybe explained better by the doctor, or it may help you fall pregnant. Okay, so I think we can start the question answer round. The first question here is by Amsavini about baby at December month because baby heartbeat stop. So then what will I do? Please, genetic disorder, and what is the genetic disorder? Okay, so I understand from the question that you were recently pregnant. In December, you conceived, and in January, baby की heartbeat stop हो गई. Usually, first trimester miscarriages के दो मेजर कॉज होते हैं. एक है जेनेटिक फैक्टर, जिसके कारण बेबी का ग्रोथ प्रॉपरली नहीं होता. मतलब स्टार्टिंग से कुछ इंडिकेशंस आते हैं इन द सोनोग्राफी, जिसमें हमें पता चलता है दैट दिस इज नॉट लुकिंग लाइक अ हेल्दी प्रेगनेंसी. बेबी के पार्ट्स डीलेड ग्रोथ होते हैं एंड द प्रेगनेंसी इवेंचुअली डज नॉट ग्रो एंड एट सम पॉइंट स्टॉप्स ग्रोइंग. द सेकेंड फैक्टर आर रिलेटेड टू द maternal ब्लड स्ट्रीम. मतलब अगर माँ को डायबिटीज है या थायराइड प्रॉब्लम्स है या फिर एक कंडीशन जिसे हम एप्ला सिंड्रोम कहते हैं वो है, या ऑटो इम्यून फैक्टर्स है, जिसके कारण फ्रॉम द मदर्स ब्लड the nutrition is not reaching the baby, या the blood in itself clots फॉर्म होने के वजह से बेबी तक पहुंच नहीं पा रहे. इसके कारण a growing baby, a good healthy growing baby suddenly stops growing. So I'm saying you require the investigations right now. Crux is to discontinue this pregnancy, and then obviously you will be offered investigations to sort of rule out इनमें से कौन से कारण थे. I hope I answered your question. We can go to the next question. In the meantime, I would like to say that prenatally, अगर आप pregnancy sorry, we have the next question before that. अगर आप prenatal या preconception stage पे हैं, तो it is important to start on certain vitamins. More specifically, I would like to say folic acid is an important vitamin जो हर एक प्री-कंसेप्शन वुमेन को कंपल्सरीली लेना चाहिए. And the second one is vitamin D. Vitamin D is optional, but I strongly recommend it because of the COVID. Everybody has been indoors. Everybody is deficient in vitamin D. So, and vitamin D definitely आपके fertility को affect करती है. So please take a loading dose of vitamin D as per the prescription with your doctor, so that you have no issues because of these vitamin deficiencies in getting pregnant. Okay. What impact does infertility have on psychological well-being? Absolutely, there's a very, very strong impact of infertility here. Basically, stress may not be a direct cause of infertility, but definitely stress at some level impacts your acceptance to problems. It ends up affecting ovulation, sometimes can cause ejaculation, erection issues for your partner, can make it difficult to try around the fertile window, can sometimes even impact IVF cycle. So we have seen that stress affects fertility, and fertility in itself, being going through a subfertile journey is definitely economically stressful. It is psychologically stressful. It is stressful in every way. So stress से infertility थोड़ी बहुत affect होती है, और infertility से stress बढ़ता है. So there is a definite role of a counselor, either in the form of your doctor or a secondary counselor that is provided via the clinic, which will help you, probably deal with this infertility. Is very important to keep that in mind, because अगर आप बहुत ज़्यादा stressed हो during your journey, it's going to either complicate your treatment cycle, it's going to affect your success rates, and it's definitely going to show in some way. So it's important that your mental well-being is kept in mind, and that you're offered some sort of counseling through your journey to make sure that you are at mental peace when you are either suffering from or going through treatment for infertility. Okay, going to the next question. What are the risk factors for infertility in all genders? Yeah, so I'd say age is a very, very strong risk factor. Nothing can be done about it apart from planning your pregnancy in time, or freezing your eggs if you are a woman who is 35 years old and has, for whatever reasons, decided to postpone her fertility. I would strongly recommend to utilize, or at least discuss with your doctor, the possibility of freezing your eggs. So age, I would say, is a major risk factor. Our stressful lifestyle, so pollution is playing a very, very crucial role in the quality of our gametes, and in the egg count and sperm counts as well. Third risk factor, very common nowadays, I would say, smoking and alcohol consumption. These are toxins. Toxin exposure is going to have an effect on your body. It actually affects every organ, and the reproductive cells very, very definitely get affected by smoking. So active, passive, both smoking is not good for you. Binge drinking also not good for fertility, is a genuine risk factor for infertility in both the genders. Apart from that, female specific, I will say, being overweight, having thyroid problems, leading an unhealthy lifestyle, not exercising, not eating fresh fruits, vegetables, trying and restricting your diet to junk food, processed food, ये सब से भी infertility बढ़ जाती है because of ovulation effects in the male. Like I said in the past, having heat exposure of any sort, prolonged saunas, using tight clothes or with a laptop on the leg, etc. All of these are male-associated risk factors for sperm problems. Okay, so these were the basic risk factors for infertility. What if my eggs don't fertilize? Okay, this is could be egg quality related. So I presume what you mean to ask by this is, in an IVF cycle, what if your eggs didn't land up with a fertilized embryo? Because there's no other way to know if your eggs are fertilizing or not. But in an IVF cycle, we can actually see, because we've injected the sperm into the egg, and now we are hoping that the fertilized egg gives us an embryo. So if the embryos are not forming subsequent to fertilization, then there can be an egg quality related problem, there can be a sperm quality related problem, and sometimes, should not be ignored, can be a lab problem as well. If the eggs don't fertilize, you mean in a standard IVF cycle where the sperm didn't manage to fertilize the egg at all, it is very classically a sperm problem, and you should be offered ICSI in this case, which is intracytoplasmic sperm injection. What are my options if I decide not to use my stored embryos? You would have ideally signed a consent form prior to the embryo freezing, wherein you will be asked what you want to be done if you do not wish to continue storing your embryos. You can offer for them to be discarded or used for research purpose. So those are your options if you decide not to use your stored embryos. If you mean you want to still conceive and do a fresh cycle, you need to undergo, for whatever reasons you were offered the IVF, if those reasons persist as a cause of infertility for you presently, you need to undergo a second IVF cycle after understanding your options, create fresh embryos and use them. I hope I have understood and answered your question properly. What causes infertility? That's exactly what we discussed in the seminar. Widely, if I was to divide, we have ovulatory problems, tubal or pelvic problems, uterine or uterine problems, lastly, sperm problems, and not to forget, quite important, unexplained problems and age problems. Okay, so I would like to put it in seven basic causes: ovulation, fallopian tube or pelvis, uterus, sperm, unexplained, sorry, six, and age. Yeah, this is how we would categorize. You can go back and re-see our talk to understand the details about each. Is infertility a woman's problem? Absolutely not. Very, very strongly not agreeing with this. It is a couple problem, regardless of where the report shows the issue in. It is a couple issue. It is something that the couple faces together and has to deal with together. Like I mentioned, as common as female infertility. So one third problems are female related, one third are male related. So male is pretty much matching up here to the causes of infertility, and the remaining one third are either unexplained factors or it's a combination of both male and female. We've seen more often than not, it's just not one sole issue. It's a combination of multiple events which have happened together, which have kind of led to the subfertility or reduced fertility for the couple. So it is not exclusively a male or a female problem. I would say it's a couple issue. Is there any other questions, or we can close the floor, I think? Does age impact a woman's fertility? Absolutely. It's a extremely important point to be kept in mind, especially nowadays with the delayed childbearing and women wanting to late marriages, etc. All of that, which is kind of pushed fertility to most women are planning pregnancy in their 30s. So age definitely affects fertility. If I was to give you a little more insight, the ovaries have a fixed number of eggs. So as a woman ages, the number of eggs drop up to the point that they become zero and a woman hits menopause. So the number of eggs are declining as the woman ages. And the second or the more important or equally important concept is the quality also deteriorates. So the eggs are arrested in a stage of cell division up to the point that that egg ovulates. So basically, from birth, if a particular egg ovulates at 35, then it has been arrested in ovulation for 35 years. So obviously, there's going to be DNA defects, there's going to be quality problems. So age सिर्फ काउंट को नहीं बट क्वालिटी को भी significantly affect करती है. So age is a very very important factor to be kept in mind. Like I said, it's factor number 6 if we are counting the causes of infertility as a cause of problem. Okay, and I think that was the last question. So let's wrap up here. I hope I was able to answer questions and give you a little bit more insight about fertility and fertility problems. Let's not call it infertility. And if there are any further issues or queries you have, you can reach to me directly. You can reach to us via Baby Chakra also. And take care. Be safe during COVID. And thanks for the patience here. See you.